What can I do for my swollen dark under eye hollows?
Thank you for your question. You've submitted a single photo which appears to be taken with you looking slightly downward, and you're asking what to do about the under eye hollows and the swollen under eye hollows. Well, just to give you a little bit about my background, I'm a board certified cosmetic surgeon, certified by the American Board of Cosmetic Surgery, and I'm a specialist trained in oculofacial plastic surgery via the American Society of Ophthalmic Plastic Reconstructive Surgery. That means that my background training was first in eye surgery before I specialized in surgery of the eyelids and the areas around the eyes and face. Yeah, I've been in practice for over 20 years in Manhattan and Long Island. So I could certainly tell you that we deal with your situation every day, and we do a lot of work in this area. So when I look at your photo, I think of a couple of things when you ask this question. First is when you look at your eyes, you notice that there is a certain amount of puffiness under the eyes. And that puffiness or under eye bag, which may be described by you as swollen, represents something called lower eyelid fat prolapse. Lower eyelid fat prolapse essentially means that the fat that's normally around your eyes, that's a normal part of the anatomy, pushes forward and creates a bulge that makes the eyes look puffy or swollen. Now, the first line of treatment for a lot of our patients is to go to the store and to buy various kinds of creams which claim to be able to solve these under eye puffy areas with no problem, but of course they don't work. And the reason is that the fat that's normally around the eye has volume and it pushes forward, and so it truly is like a hernia, and we refer to it as herniated fat. Now, below the area of herniated fat, you can see that the eyelid to cheek area, as well as the cheek area, there's volume loss. Now, this is consistent with normal facial aging. This is something I wrote about in a book a few years ago, but essentially the concept of facial aging has two elements. One is volume loss. We lose bone, muscle, and fat as we get older. In addition, there is descent or sagging. And especially when you get into your 50s or as early as the early to mid 40s, depending on family history, you can start manifesting both. So, in our practice, when we meet with a patient like yourself, we first work on dealing with the dominant feature, which, from my perspective, is the puffiness under the eyes, and the approach to treating that puffiness under the eyes. So what do we do? Well, the essential issue is to surgically correct that puffiness. Now, when you do your research, you'll learn about non-surgical options, whether they're thermal devices or injectables, but judging by the amount of volume you have, I don't think that either modality will be of value to you. What we would do probably for you is something called a transconjunctival blepharoplasty. This is a procedure where we treat the fat pockets from behind the eyelid. We make no incision on the outside, and we'll treat the skin quality and skin overall appearance with something called platelet-rich plasma. This is derived from your own blood and basically leverages or uses your own body's growth factors and healing properties from your blood to stimulate and improve skin quality. In certain patients, we'll use radiofrequency, while other patients will use fractional CO2 laser to improve skin texture or resurface the top layer of skin. So there is a combined approach to try to get the maximal aesthetics. But we also discuss a strategy and how to address the adjacent areas, the areas where they're not as important to you right now, but they may become important later once the big dominant factor is reduced. And that's the eyelid to cheek junction and the cheek area. And depending on what your desired outcome is, There's solutions that include improvement in volume. There's solutions that include surgical elevation, depending on how extensive you want to rejuvenate your face. So the procedure we do is also done under local anesthesia with light sedation. I've been doing this for many years, and we've developed a very nice protocol so our patients are able to recover faster and reduce the risks of having the procedure under general anesthesia. We do this in our own facility within both of our offices, which are certified by the Joint Commission, which is the governing body that oversees hospitals and surgery centers for implementation of certain safety and protocols, so that there's no difference between the quality of care regardless of the location, as long as certain safety-focused standards are met. And that's, of course, of highest value. So with that being said, I would suggest that you meet with experienced qualified cosmetic surgeons. I think that people who specialize in eyelids, particularly cosmetic eyelid surgery, not just reconstructive, but deal with a lot of cosmetic patients, because really cosmetic surgery is its own specialty, separate from other areas. And again, it's a matter of really not just the name, but what kind of practice the doctor has. We only have so many hours in a day, and we can only do so many things. So we always have to, the best quality from my experience is focusing in specific specialized areas and not doing everything. So meet with the doctor, get comfortable, look at their before and after pictures, understand what you could expect after the procedure, and I think you're going to be very happy. You know, one of the most satisfying procedures we do is to help people with under eye bags. People always feel like they look tired, they look in the mirror, and they feel tired. So the phrase "tired of looking tired" is something we get to hear a lot. And once it's done, it really has a transformative effect on the facial appearance. It's almost like doing a facelift in the right candidate. So I hope that was helpful. I wish you the best of luck, and thank you for your question.